talk.
And I wasn't
Yeah.
sure. Perfect.
Yes,
Is
let her go
Marita
on.
back?
I don't, she's saying her link has expired. I don't see it get her. Trying to get her.
All right.
I think we should. Can we wait for her to come back before we begin?
Okay. All right. Thank you so much. And we're going to focus more on the traditions and the cultural beliefs. Here in Uganda, there are very many various traditions and cultures and beliefs that influence the men's mental health. For example, the expectations of men to be very strong, like we discussed earlier. We're always emphasizing that men don't cry, but we find that in this world right now, everybody who is going through something, they should be given a chance to sit down and go through what they're going through and be able to cry and open up, because when you cry and open up about something, there is the best chance that you're going to get some kind of help. So the fact that men are believed to suppress, they're expected to suppress their emotions and not show any kind of vulnerability, affects their way of looking for help. This is another thing that is brought about that make men go into depression. That's why you find men go into more depression than women. Women speak up, women talk to friends, women go outside in groups and have conversations, but men suppress their feelings. So this affects them. We also discussed about the stigma and the discrimination that is brought about with the culture and the society, the stigmatization and the misunderstanding of mental health among men. Men are discouraged to seek for help, seek for professional help, cannot go for therapy and counseling because of the misunderstanding that therapy is supposed to be bad, is supposed to be wrong. We need to change the narrative and encourage men and support them to go seek for some kind of help when they're having a hard time. The other point is the cultural support system. Well, I'm happy to tell you that our society in Uganda today, we have a positive side because a Ugandan culture and the Ugandan society, our communities are more stronger. We are more of extended families, and we're structured in a way that we support one another. So that's why you don't find so many big numbers of people who go into depression, because commonly Uganda, we're known to be social people, and we go to each other and talk to each other. But it doesn't mean that our men are not struggling. We still have a big number, according to research, we still have a big number of men who cannot be able to express, who cannot be able up and say, yes, I'm having a hard time. So on this platform today, I want to encourage our other men, all the men out there, that seeking for help and asking for help is not a sign of weakness. And also, if you're having struggling and you're going through a hard time, we want to let you know that there are so many places you can go for help. And there are so many ways you can ask for help without exactly revealing what you're going through. But we encourage the men to go out there and find somebody they can talk to, find ways to relieve themselves. For example, going to groups, going to therapy, and find means of relaxation, because so many men have undermined stress. They think they are supposed to go through stress and that's their way, or the way of life. But that's not true, because when you continue going through stress, you can reach a breaking point where you can no longer be able to handle the situation. So do not undermine the stress, and be able to find ways to get help and get support through counseling and through other community groups, so that you won't go through a situation all alone. So I hand over to you, Mr. Ntwatwa. I hope somebody took a point out of that. And we're continuing to talk about men's mental health today on Father's Day. Thank you so much for having me.
Thank you. Thank you. This is wonderful. In fact, we understood the focus. Your question and the way you answered provided an opportunity to discuss the impact of cultural practices on mental well-being and how cultural sensitivity can be integrated into the mental health support system. To Farida, my dear, what strategies or initiatives have been implemented in Uganda to address the stigma surrounding men's mental health, and what have been their outcomes?
Okay, thank you, Brian. My name is Farida Nakoma. I'm a clinical psychologist, although Brian introduced me as a psychiatrist. I'm a clinical psychologist and a lecturer of psychology. I'm a trainer of mental health personnel. I'm a developer of training material for capacity building in different mental health related fields. I'm also a trainer in substance use disorders and its treatment and prevention and recovery, among many other things. Before I talk about my question or my topic, I just want to add that I don't know if Brian didn't have the time when he talked about the challenges that men face. Of late, I feel like there's this new challenge that many of our Ugandan men are facing that is related to feminism and equality for women. Our men are taught culturally to, we know how we expect our men to be in charge, to be dominant, to be the leaders, to be instructing the wives. The wives are supposed to be submissive. And now the world is saying equality of roles. If we both go to work, then we can also share other roles. If we come back late, you can cook food as the husband. So I think a lot of men are finding this confusing. I'm not so sure because I'm not a man, but to be honest, when you see comments about feminism and equality for women and all, you realize that there are so many questions that men are having now about this. It threatens their position, or at least what they know about their role as a man. And I don't think that if someone is in such a confusing situation for long, it won't impact their mental health. It causes anxiety, it causes feelings of doubt. You're not sure if, you're on the wrong this side and all. So I think that is also something that men here in Uganda have to also come to terms with and see that is where the world is heading, and they might have to adjust a lot of what has been taught to them at home and in religious places. So going back to my question, what strategies have been implemented in Uganda to address the stigma surrounding men's mental health? Now, yesterday I was briefly talking with Diana and I was telling her, we look at that in two ways. The strategies that are formal, and then the strategies that are informal. Informal strategies, I think, are the most that are not even probably talked about much, where men are trying to help themselves without any particular structures that are guiding them, maybe from, let's say, government structures that would be in place. So we see, for example, media campaigns where people are trying to, to bring to awareness the fact that men are also suffering. Men are human first, then they become men. So they are affected by everyday stresses. They are affected by a lot of the cultural expectations. They are human and they can be sick. And then yes, media campaigns are in form of, social media. I have a Twitter space that usually I listen to. It's held by some of my former students, and a lot of these things come up. So they organize it. They talk about their stresses. They talk about how their mental health is suffering one or another, and then they encourage each other on these campaigns. So some of these strategies also, they not only talk about their mental health, but they're also talking about skills that they need. They talk about how things are changing generally, how their role as men is being, shaken left, right, and center, and what they need to do. So it's more like they conduct simple, counseling talks for each other. Sometimes they invite people to talk to them. And then there are support groups or men's initiatives, physical ones, especially. I think I first heard them from the born again groups of a few people I know in the born again groups. So they have men groups, and these are things that they're talking about. I think this is also an example of something that is informal, but they have these groups, they discuss their things. I don't really join them, but I know that they will tell you that they support each other in the process of being men. They are not finding it easy. I think also traditionally we've had like family members assigned to boys or growing men. Koja will speak to a growing man. Those are all strategies to improve mental health, to guide the person in the way they should be, so that they find fewer challenges. So men support groups can also be in form of like old boys associations. That I've seen things like that, where boys have their groups, and some of them are speaking about such challenges. So the statistics, of course, of challenges of mental health in men are also there to be shown. So in such groups, or whenever there is any kind of campaign or awareness campaign, these messages come up. For example, we know that there are certain mental illnesses that are more prevalent in men than in women. So the fact that they need to be talked about, or that they are being talked about, increases the awareness that actually what I am going through is not normal. This is an illness. So that is important. That is important. And then, of course, they seek therapy, some of them, as a strategy to improve their mental health. They seek therapy, they get counseling, which is probably also not very well established as a service in the country. That's a challenge. But once they find out, there are those who will actually go, and it works. So there are also, I think, what I would call another formal method is, I think our Ministry of Health is trying as much as possible to reach the communities as regards mental health problems. Recently, they have increased the number of mental health workers at different levels. They are recruiting, for example, counselors in hospitals, clinical psychologists in the new structure of Ministry of Health. That is something big. I think that is a very big step, and it's going to really help. So yes, for now, I can't stop there.
Wow.
Back to you, Brian.
Thank you so much. Thank you so much. That is so powerful. That is so powerful. I think I will go ahead and ask you, how can communities and healthcare systems in Uganda promote a more inclusive and supportive environment for men's mental health?
Yes, starting with communities, I would say we have different community leaders at different levels. Leaders being empowered to speak about this would help a lot. If somebody is an authority in the community, somebody you look up to, comes out and speaks about something, it will reduce the stigma that others attach to the mental health problem. So community leaders need to be empowered. And I think if there could be even some simple awareness campaigns and trainings for them, it would help so that they can guide their people. I mean, we're not saying we train them to be therapists, but we are saying let them be aware that this is something that needs to be addressed and talked about. And then, of course, adding to that, sensitization campaigns in communities are important. Like if you have a day like Father's Day like this, or you have a mental health awareness month, we had it last month, conduct awareness programs at different levels, on radios, in communities, wherever it is that you can do it, and inform people of what is out there. A lot of mental health, like I said, a lot of mental health challenges are considered normal by people, are considered change, or someone is just being weak, or but then if we talk about these things in different ways, it would help. And then, of course, when it comes to men in particular, we need to encourage men to display emotions. We need to encourage men and young boys, the sons we are raising. We don't need to shame them about talking about their feelings. I think that there is that common term called toxic masculinity, where a man is supposed to be a certain way, and one of them is not to show that he's sad, or he's weak, or he needs assistance. So I think in families, before even we go to communities, we need to address that issue of men don't cry. Your little boy is playing and he falls down, and then when he's trying to cry and you say, no, be a man. No, that is how it starts, So you're shaming him for feeling a certain way, and as he gets older, he will not be talking about what he's feeling, because it will make him look like he's not what he's supposed to be. So another community strategy could be, we could get people sharing their stories. We could get testimonies of people who have been through mental health situations that have been resolved, for example. That can be a sign to others that you can also come up and seek help. And then, and then, of course, when we talk about healthcare providers, that is the other section of the question. What can healthcare providers do to improve mental health services for men? Like I was telling Diana yesterday, that for me, when I'm talking about healthcare providers, I don't really separate them from policymakers. So they go hand in hand, because healthcare services are usually controlled by government policies. So not only controlled, but also funded. So if we could get like sensitization campaigns funded from up there, they most likely will be more professional, and they will reach many people, and they will be more organized by healthcare professionals. So if we have a psychiatrist speaking to people in a community or in whatever gathering people are more likely to listen to an expert on a subject, and they will take that person's word seriously than if it's just, for example, a community leader. So if we get healthcare providers who are in that profession of dealing with mental health problems speaking, then we will get more people taking it seriously. And then I think healthcare services could include screening services, screening where there are brief checks of anybody probably who has gone to hospital. There could be a few, tools, questions here and there that can identify whether someone is in the right mental state for the last few months, because these instruments are actually there. These tools that screen for simple mental health status are actually there and easy to use. So if healthcare providers can include that, it would capture a lot of these problems at an early stage. And then, of course, availing services for mental health problems, make services accessible make them cheap, make them available from the lowest level. If there is a health center 2, 3, can there be somebody, at least a psychiatric nurse, at least if you can't have a full psychiatrist there could be somebody at whatever level to be able to address some of these problems. So availability, of course, has the components I've mentioned, being accessible, being affordable. You don't have to wonder where to seek services. So even when someone has a problem, they start to say, where do I start? Where do I even start to seek treatment? There should be these services from at the different levels. And then healthcare providers, the personnel, nurses, doctors, whoever is in touch with patients, should be given, I believe there should be some capacity building trainings for many of our healthcare personnel, because as much as they know that mental health problems exist, they are also a product of our culture. They have grown up in a culture which makes them ignore men's mental health problems because they think men are supposed to be strong. So they also need to be sensitized a little more, or even trained on some of those things, especially those who are not directly dealing with the mental health people. Allow me to stop here for now. Maybe we can discuss and add later.
Thank you. That was really very prolific. Please, if you're not using your microphone or not speaking, mute it kindly. Thank you. As we conclude, I would like to request Diana and Farida to give us closing remarks. If anyone has a question, they should be able to write it down, and then perhaps as our key presenters conclude, they would be able to get the question and answer it. And also, I have a simple question, is that as we conclude this wonderful segment, what are the causes of mental health? I know we have extensively talked about these things, but I have not had drugs being pointed out. We know so many young artists in Uganda who are also potential fathers and mothers that have ended up getting of abuse. Yeah, thank you.
Oh, well, thank you so much. Do I have the opportunity to speak? Yes, Brian, can I continue?
Yes, please, go ahead.
All right. Thank you so much. Thank you, Farida, for that wonderful presentation. And I just wanted to point out something before we talk about the causes of mental health, because there are so many different causes. But as we talk about men's mental health, there are things I wanted us not to go unnoticed or mentioned. Those who are mainly at least risk. I want the listeners to know the main segment of people who are at least risk among the men are these people. The men who have experienced any kind of trauma in their lives, they are more likely to have mental health problems along the way. And also, I want the viewers to point out, to know that the men who are having employment issues and they're having a difficult time having ends meet, being able to provide for their homes, they are having and they'll be at risk of having mental health problems. And those who are having marital problems like divorce, they're more likely to go into depression. And all those factors will lead to people having mental health problems. People who are struggling financially, they will end up having difficult problems or mental health issues. Whereas also those who are having alcohol and drug abuse problems may end up having triggers, may end up having mental health conditions that may end up also in mental health problems. As well, those people who are struggling and they're worried and they think they cannot go on any longer, those men are more likely to end up committing suicide. So having said that, I want our listeners to know, as you go home to your loved ones, be able to look out to some of the symptoms. We want the people to know that there are things we should watch out as we look for this. They're angry all the time, they're irritable, and they're having changes in their mood all these people may end up maybe having some underlying mental health problem need to be addressed. If somebody has sleep problems, somebody is facing appetite problems, they can't eat, they're no longer focusing on work the way they were supposed to, they're having changes in the behavior, they're feeling at rage, and they're restless. These people may be having some serious mental health problems that may need to be addressed and may need help. And those who are having alcohol problems also may need to be looked at. So I want us not to forget to be able to understand these symptoms and to be able to look for them. Feelings of sadness, feelings of helplessness, somebody who is emotionally flat, they may be having some mental health problems. So please be on the lookout and guide these people to where they can get help. So thank you so much for listening to me, and I'll hand it over to you, Mr. Breyer.
Over to you, Farida, as closing remarks. Thank you.
In regard to today being Father's Day, I want to say that studies have shown that children who have grown up in homes without fathers have certain behaviors, have problematic lives. I'm not saying all, but there is a very high percentage of certain problems, crime, problematic use of drugs, certain, maybe what people used to call sexual perversions. These are common somehow. The relationship is very strong. Absent father with certain behaviors in youths. So it's important for fathers to be available. It's important for fathers to have a relationship with their children. It's important for the child, but also for the parent in the long run, because if you put in the effort at the young age, then you don't really have to worry so much when your child is older. Otherwise, you're going to continue parenting and helping out with his own children. So I don't want to go into the exact depth of the problems associated with absent fathers, but there's a lot of literature out there. Those who are interested can read about it. Talking about what is the cause of mental health problems, there is not a single cause that would say this is what causes. There is what we call the biopsychosocial model, that your biology, your physical body will get a problem, or you were born with a problem, and then you add on a psychological factor, such as maybe a social factor or social, such as the stress that in the environment you're living in, you're probably divorcing your wife. So at the wrong time, when these factors combine, you might not escape the mental health problem. So even in the process of who will get better, who will have better treatment outcomes, a lot of those factors have to be considered. You cannot just look at just one factor. There are so many factors that interplay for the person to become sick. That's all I can say for now. Thank you.
Thank you so much, everyone that has really contributed to this wonderful segment. Happy Father's Day. And until we meet again, God bless you. Cheers. Bye.
Thank you, Brian. Thank you, Diana. Thank you, Farida. Thank you, Paul. Thank you, George. This marks the end of the meeting. We'll keep you updated on next meetings. Bye.